I'm Debbie Kahnen, and I'm sitting here and going to introduce you to a very special person today. This is Bethlyn Gerard. Hi, Bethlyn.
Hi.
Bethlyn's an expert in energy medicine, and so we're very fortunate to have her in this conversation today. We actually met because I was under a tremendous amount of stress as a nurse at the hospital, and I was telling her my story and all the different things I was learning. And I was very inspired by Bethlyn and what she had to share, and we recognized that there were many other nurses and people experiencing chronic stress and developing health challenges like I was experiencing. So we were talking specifically about nurses and the challenges they face.
Yeah, and I'd really like to back up and get your experience, like what prompted you to call me. I have 3 daughters on the nursing track, and I have been a process improvement consultant in hospital systems, and so I'm committed to healthcare. My background is as a CPA, and from those early auditing days, I have gone on to do a lot of research and get several clinical certifications, and it's about stress and the cost of healthcare and the impact of the care we're delivering now versus moving toward a prevention and wellness model as a country. And so I bring a finance and a clinical expertise to it, and I'm really committed, not just in my own family, to the nurses that we're developing, but to the whole country getting highly reliable, affordable care.
So, and so that's really one of the ways that I ran across Bethlyn was I had just finished studying biofeedback and didn't recognize how much that chronic stress in my job had been affecting me. And I also knew, being in nursing leadership, that we kept noticing that the nurses weren't using their broad thinking, looking at the big picture, noticing everything that was going on. They'd gotten to doing just tasks. And this was a huge problem because what the hospitals do is they create policies and procedures that are very prescriptive. And so the nurses have to do this, 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 and this, instead of in helping them to be able to look at the big picture and think. And I realized and recognized doing the biofeedback training what they're dealing with is chronic stress, and they're not being able to see the big picture. They're only being able to focus on the tasks because of the stress, and it's also affecting their health.
So how we have biofeedback in common is that I actually left a position as an internal consultant in the hospital system with the Daughters of Charity, and I moved for a family health issue. Before I moved, the daughters brought me in as a financial consultant to say, we're studying holistic touch, we're noticing that when we lay hands on with therapeutic touch, there's a whole change in the patient's outcome. Excuse me, the woman who taught me my first holistic touch class was actually an MBA, and her left brain did not want to believe in any of this energy medicine, but she had been called to the bedside of a single mother who'd had an organ transplant, and she was rejecting her organ. Now, the commitment of these Catholic nuns to the sanctity of life and to the sanctity of the family unit was what got this business-oriented woman over her skepticism. And it can't hurt, might help, kind of like chicken soup. You know, it doesn't hurt to try. So she did some work that she learned from Brew Joy MD. So he's a doctor, and he was a child prodigy, and went on to have his own health issues and started to study energy medicine as well. So in his book, Joy's Way, there's something called the chakra connection. So this woman goes to this transplant patient, performs a chakra connection, and it reverses her outcome, and the tissue starts to work together, and the woman doesn't die, and she accepts her organ, and that started this finance MBA leader studying energy medicine. So they brought me in as a finance consultant to work with the new nursing policies, to work with tracking the outcomes, and before I could do that, chronic stress took its toll on one of my family members, and I relocated. And I started working with the surgeon on that family case who had a biofeedback device. So I actually trained under this surgeon and was apprenticed with him in his hospital clients. And we took a business plan to investors, and it ended up being a 4-year research project. So why do you care about that? Well, because we're going to explain to you not only the basic stress response, which many of us may have had in anatomy class or nursing training, by connecting the dots to our day-to-day jobs and our day-to-day family responsibilities, and reminding ourselves how to notice and neutralize and navigate. So the 3 N's. To notice when stress is impacting our ability to be effective, to neutralize it with energy medicine techniques and other health-related information about supporting your immune system, because you have to have your energy open and flowing and your immune system out of an adrenaline response to be able to get into the innovative, creative thinking that the future solutions require. So we're calling this the new nursing, because we're bringing a wealth of information of a lot of the ways it doesn't work and hasn't worked, and how our own health has been impacted with the pressures from our jobs, to how do we get healthcare workers that are healthy to bring their energy to vulnerable patients so that there's a hope of a good outcome. Because if the people providing the care are all stressed and out of balance, then what kind of impact does somebody who's already vulnerable and already in our care for help? It becomes a downward spiral.